I'm Dr. Yogishwar A V, Consultant Orthopaedic and Joint Replacement Surgeon. I'm specialized in sports medicine as well, practicing at JANVI Orthopedic Center, Rajeshwari, Nagar. Today we are going to talk about a very common problem, osteoarthritis. First we need to understand what is arthritis and what is osteoarthritis. See, arthritis is nothing but wear and tear of a joint. So most commonly involved joint is a weight bearing area, that is the knee joint. So to understand the knee joint, let us go into the anatomy of the knee joint. So the knee joint is basically made up of two bones. So the thigh bone and the leg bone. In between you have a cushion, we call it as a menisci, and you have a front and knee cap. It's a patella which acts as a knee cap, helps in sliding movement. So the knee consists of a slimy or a buttery surface which we call it as a cartilage. So arthritis is nothing but wear and tear of this cartilage. So that is what we call it as a arthritis. So coming on to arthritis, there are two types of arthritis. One is a primary arthritis, another one is a secondary arthritis. So what is a primary arthritis? Primary arthritis is nothing but age related wear and tear of a joint. So as the age progresses, there will be a little bit of a movement happening around the knee which causes wear and tear. So as the age progresses, usually the tear rate and the wear rate will be balanced. So once the tear rate increases and the wear rate decreases, that is when the arthritis sets in. So arthritis is a phenomena which exists in everybody. It may be in a mild grade, it may be in a moderate grade. So saying that arthritis, it doesn't happen in very young individuals, is all false. So wear and tear, it keeps on happening from the day we start walking. So what we need to understand is, so how much is the wear rate and how much is the tear rate. So what we usually broadly classify, as I was telling, like there is secondary arthritis as well. So secondary arthritis is nothing but an inflammatory arthritis, or maybe due to trauma. There is an injury around the knee, and because of the injury the arthritis sets in. Or there is an inflammation around the knee, because of the inflammation the arthritis sets in. There are various inflammatory conditions like rheumatoid arthritis, psoriatic arthritis and other things. Today we keep our discussion broadly into management of arthritis, especially during this COVID situation. So COVID situation is a condition where we have to follow certain norms, we have to have this social distancing, we have to wear masks, we can't step out of the house for unnecessary reason. So in an arthritic patient, what we advise is always to go out and walk. So that is the first dictum what we say in arthritic patient. Movement is life. In a knee joint, the movement is always we say that it increases the life of the knee joint, as against some people who think that the more we move, the more damage which happens. No, it's not like that. The movement, the more we do the movement, the synovial fluid inside the jelly substance which increases the production, and that helps in preventing of a wear and tear. So we advise every patient to have some movement in the knee. So since in the COVID situation, the people are unable to walk. So what is the alternative? What we say is, how much ever possible, maintain a social distancing and go for a walk. Walk, you need not have to go for a park or something where a lot of people gather. So walking in front of your house, walking on your terrace, walking in the balcony, all those things will act as an active part in managing arthritis. There are two simple exercises which I would like to teach you. So one is active quadriceps exercises, where you sit comfortably on your chair with your back supported, extend your knee, pull the foot towards yourself and holding it for 10 seconds and then relax. So this is a simple exercise which everybody can do in a household activity. So sitting in a chair while watching TV or when you are relaxing, you can do it. Do 10 repetitions in the morning and 10 repetitions in the evening. This is the simple basic exercise for knee arthritis. Coming on to the pathophysiology of arthritis. Arthritis is divided into 4 stages: grade 1, grade 2, grade 3 and grade 4. So grade 1, grade 2 are a simple early stage of arthritis, what we call, which can be managed with a little bit of a movement, taking rest, taking some anti-inflammatory medication. Those will take care of mild to mild arthritis, or grade 1 and grade 2 arthritis. What we are interested today in talking about is grade 3 and grade 4 arthritis. So grade 3 arthritis, where the cartilage damage is more than 50% of the cartilage has been damaged. You can see this model where the cartilage here is intact. This is a normal knee joint. So when you look into the other model, where you can notice the cartilage has been damaged. So this is a very increased wear and tear. So this is what we are trying to discuss today. So what we can do in order to get away from this arthritis. Obviously, see, grade 3 is an arthritis where the damage is not too severe. If it's a too severe joint where the joint is completely worn out, then obviously yes, we suggest them to go ahead for a surgery. What we call it as a knee replacement. Today we are more interested in talking about grade 3 arthritis where the arthritis is severe but not to an extent that it requires any surgical intervention. So at this point of time, there are certain drugs which helps us in controlling arthritis. For example, we cannot advise NSAIDs for a patient with grade 3 arthritis because the requirement of NSAIDs will be on a day-to-day basis. And if people start taking NSAIDs on day-to-day basis, it leads to renal complication. So today I would like to add on, which is an age-old molecule called as a glucosamine. Glucosamine is nothing but a compound which is naturally found in the body made up of fructose and glutamine amino acid. So this glucosamine, which is a molecule which we give to the patient, it breaks down into a glucosaminoglycan. Glucosaminoglycan is a molecule which helps in repair of this cartilage. So what we intend to give during this grade 3 arthritis is a molecule which is not an NSAIDs, but at the same time it should help in healing of the arthritis. So the repair process needs to be continued. So we advise a molecule called as a glucosaminoglycan, so Glycan, which helps in repair of the cartilage. Once the repair is happening, at the same time it also controls the pain. So what we advise at home is whoever are elderly, who are not able to go out, who are having knee pain, we advise them to first have a regular walk in the house, in the balcony or on the terrace or in front of their house. 15 to 20 minutes of a walk is what we prescribe. Doing simple exercise like what I thought, extending your knee, pulling the foot towards yourself, holding for 10 seconds, relaxing, simple exercise. Along with that, a substitute. The glucosaminoglycan, along with that you have a various combination with chondroitin sulfate and native type 2 collagen. There are various molecules in the market. So you pick one and keep taking that. Once a day is good enough. You take one tablet a day. That helps in preventing further damage and also helps in repair of the cartilage. And one more the thing I need to talk is a grade 4 arthritis where the cartilage is fully worn out. So at that point of time, what we need to do? So usually when there is a grade 4 arthritis, the only solution at that point is when the cartilage is fully worn out, the bone is literally sitting on the bone. So at this stage, whatever medication we give, all those will be temporary. Even with glucosaminoglycan, the role of glucosaminoglycan, chondroitin sulfate or various other molecules in grade 4 arthritis is very minimal. So at that time, there is a only solution is a knee replacement. Knee replacement is nothing but we remove this degraded part above and below. We put a sort of a cap above and a plate below with an artificial plastic in between. So this is what is a knee replacement surgery. You can see now there is a gliding movement. Here the metal is rubbing on the plastic. So the pain component will not be there. The pain happens when the bone rubs on the bone in this condition. So with a knee replacement, what we are trying to do is we are taking away that rubbing of the bones and creating an artificial joint. So this usually has a lifespan of 20 to 25 years. So it's a very successful surgery, and because of COVID and all, we are a little bit hesitant to go ahead for any surgery. But with the medical conditions improved and the COVID, I don't think it will go away in near future. So we advise any people who can wait for a couple of months unless the COVID situation comes down. But if the pain is too severe, then we don't advise them to keep waiting at home, because the COVID will not go away in like 4 months, 5 months, 6 months. We don't know when it goes. So in that case scenario, consult your doctor, consult your orthopedician. Don't hesitate to undergo knee replacement surgery. Knee replacement surgery, we do it now also as a routinely
only with people who are in very need or very severe pain, because this is a life-changing surgery. I won't ask the patient with a severe knee pain just to sit at home afraid of COVID and all. Now we have all the mechanisms where we test a patient for COVID. All our staff are taking all the precautions, wear a PPE kit, and the patients are also segregated. They are kept in a different ward, different zone away from the COVID, and they can be treated. My message is, if you have a severe pain, don't just sit at home and wait. Severe pain, uncontrollable, not even coming under control with medication, consult your orthopedician. Don't hesitate to undergo knee replacement. Knee replacement can be done safely even during COVID. We take all the precautions necessary and we do carry out a knee replacement surgery. So rest of the people who are having mild to moderate arthritis, just go out, go for a walk, keep social distancing, wear mask, use sanitization, and I think you can fight against arthritis. My message is simple. So mobility is life for the knee. So keep moving, and that will keep the arthritis away. It's a simple thing. And if you have any queries, you can reach me at JANVI Orthopedic Center. You can visit my website. If you have any queries, you can post it there. So I will try to help you out if required. Thank you.